Dr. George Porter is with us. He is the author of a book called Pet ER. Dr. Porter served at a number of animal hospitals. At one point, he was on call for 11 different animal hospitals, all on the same weekend. He would take 100 calls a month, and he has come up with some amazing stories in this book of some of his experiences. Dr. Porter, thanks for being with us today.
Glad to be with you, Steve.
I guess since I don't have a pet, I was a little bit surprised to read some of this. I didn't realize that there was an emergency room for animals. Explain why there's a need for that.
Well, the emergency room is established for two reasons. One is so that every veterinary hospital doesn't have to have their own doctor on duty every night. And the other is for the client, so the client doesn't have to call 5 or 6 hospitals to find a doctor that is on duty.
Mm-hmm.
So it's a kind of a mutual thing. It's a community effort.
So would the procedure be that the client would call their normal vet, and then the call would transfer to you, or what?
Right. They leave a message on their answering machine to refer it over to us.
And you really, literally would run yourself ragged some weekends taking these calls.
Yes, sometimes it's real bad. I average about 2 calls a night, but on weekends, sometimes 15 to 25.
Now, what's the difference between a small animal doctor, that's what you are, and a large animal doctor, and maybe even an exotic animal veterinarian?
Well, a small animal clinician usually has the animals come to them. While in, of course, the farm animals, like a James Harriet situation, he has to go out on the farm and take care of them there. Because everything that we have is usually, all the instruments and everything are located within the hospital.
Mm-hmm. What about an exotic animal vet?
Well, an exotic animal vet is a little different kind of breed. We call them zoo veterinarians, kind of, in a sense, because they have to have versatility in many different types of animals.
Mm-hmm. So you specialized in small animals.
Mostly cats and dogs. About 98% of my practice was cats and dogs.
And yet there were occasions when you rarely had to go out and do something with larger animals, right?
Right. Those are the ones that kind of stress me sometimes.
Like what?
But you still have the knowledge, even if you don't have all the instruments that you'd like to have.
What were some of your most stressful situations?
Well, most of the time, it was a situation and not an animal. I had a call in Manhattan Beach where I pulled in at 2 o'clock in the morning. There was 4 Harley-Davidsons out front and 4 guys in leather jackets, and I didn't come up to the shoulder of either one, any of them, plus a young lady that was with them, all dressed in leather and holding a chihuahua. And they wanted me to... I was responding to the call because the chihuahua was acting peculiar. So anyway, we went inside and got into the exam room, and I looked at the dog, and the eyes were dilated, and I was rather suspicious of drugs. So I asked him, I said, well, what did you give this dog? And all I got was glances between them. They looked around at each other, and I said, now you got to tell me what you've given this dog so I can treat it. I have no idea what to treat exactly unless you communicate with me. And finally, one of them said, oh, darn it, Meg, you go ahead and tell him. She said, well, we had some PCP scattered into potato chips, and the dog got up on the coffee table and ate some of the potato chips.
PCP and the potato chips.
Yeah. And so about that time, 2 of the fellows that were standing there said, we're going outside for a smoke. And so I took the dog in the back of the hospital and gave it a few drugs that would assist it a little bit in the recovery. And went back out in front and told them, well, I think we better keep the dog here overnight. And they said, no way. And they were very insistent, so I said I brought the dog back out. About that time, here come the 2 guys in from the outside with a police officer behind them. And that was a blessing for me because I was getting kind of uneasy about the whole situation.
You were.
And the officer walked in nonchalantly and said, hey, Doc, I saw your light on in here this morning and thought maybe you might still have the coffee pot on. And I'd never seen this officer before. So all of a sudden, the money appeared on the table, and those guys were gone. So I really didn't have much in the way of treatment on it, but I was very relieved before the night was over with.
Yeah, and the policeman was just looking out for you, right?
Well, yes, he was just driving by and saw 4 motorcycles out in front and the lights on. I guess he thought he'd better stick his head in the door, and I really appreciated it.
Many of the stories in the book, Dr. Porter, seem to revolve around small animals digesting something that they shouldn't. I mean, I'm just amazed to read about, like, this dog. You had a dog that would eat rocks and eat pieces of brick. Yeah. I mean, are these animals dumb or what?
No, I think they have a certain craving, and then things are available. The thing I noticed in my practice here is that if you treat an animal with the same security and understanding that you would a child, you don't get into problems as many. You don't leave gates open and let kids get out in the street. You don't leave gates open and let dogs get out and their cats get out in the street. Of course, cats can jump over, but you don't leave poison things down. You don't, it's just common sense many times, but we think that animals can care for themselves, but they can't care for themselves any better than children can care for themselves.
But isn't there a natural instinct for them to not eat, like, pieces of brick?
Well, yes, I guess so. But there's been some research saying that sometimes there's salt cravings and things like that, they do that. And sometimes it just develops into a habit.
So you literally had to open up some of these animals and pull some of this stuff out, right?
Yeah. Yeah, it's funny. I took a dog came in one time, and I could hear this noise as I walked along. It sounded like a bunch of castanets. And I told the owner that I could palpate in the stomach from the exterior. I could palpate some objects in the stomach. So I took an X-ray of it, and then took the radiograph out and showed the owner. And he said, "Oh," he said, "that's what it usually looks like." And I said, "What do you mean?" He said, "Well, this dog eats everything." And we had to take it into surgery. And I pulled out some pieces of brick, rocks, a few marbles. One of these little Hot Wheel cars. It was about
Hot Wheels.
an inch and a half long, and it was regularly a junk pile. So you never know what you're going to run into. When you leave the house at night, you don't know whether you're going to be back in 45 minutes, which is about the quickest trip, or 3 hours if you have a major surgery.
Now, what's that word that you have in the book when an animal consumes an inedible object?
That's pica.
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 P-I-C-A.
Yes, that is right.
And that's the official word that you use when an animal eats something it shouldn't.
That's when they eat something that's inedible.
Yeah. Very interesting. The book's...
They're not digestible. They're always edible if you're talking about getting by the mouth, but when it's not digestible, logic.
Dr. Porter, I'm sure you've had to do some very difficult things. People have probably had to bring in their pets to have you put them to sleep, right?
That is correct.
And tell us about that situation, how you have to handle that.
Well, it's an emotional problem. It's not an easy thing, and so many times they kind of look at you and say, well, you're kind of used to doing this sort of thing, but they don't know how many tears well up in our eyes after the clients leave, because particularly if we've been treating that animal for years, doing the daytime practice.
Right.
But it's not an easy thing, and we never really get conditioned for it. It's just a responsibility we have.
So if people brought in a fairly young animal, and yet because of the problem, you've still had to put it to sleep?
Once in a while that happens. I will encourage them to try to find a home for it, or if an animal is a young animal and injured and maybe they can't afford to have the surgery done on, like a broken limb or something like that, I will have them assign the animal over to me, and I'll try to find a home for it.
Mm-hmm. Very interesting.
Which is how we acquired a cat one time. I took it home for convalescence. The cat's name was Faux because I had a broken foreleg.
Mm-hmm.
And we took it home for convalescence, and it became a part of the family.
Yeah. This is Stephen Winsenberg. My guest is Dr. George Porter. He's the author of a book called Pet ER. He used to run a pet emergency room. And we're taking phone calls from local listeners about some of their pet stories. Let's go to Kevin first. Good morning, Kevin.
Hi there.
Tell us your story.
Well, we got sort of inherited a pair of cats about a year and a half ago. And the one cat, Baby, long-haired Maine Coon, nice, blue eyes, pretty cat, lived under the couch, would not come out. And by the time it was all over and done with, we finally had to lift up the couch and drag this cat out. Well, sometime along the way, I don't know if she did it or if one of us putting the recliners down, because the recliner at each end, it got the tendon along the back of the leg that makes the back leg work.
Yeah.
Had got severed completely in two.
Oh.
The Achilles tendon.
Yeah. No idea about this cat. We just got him almost literally dumped on us. The cat hides, no social value whatsoever. It didn't even like people. And we had to drag it down to the ER on 2nd Avenue.
What'd that cost you?
$500 and some bucks
Oh,
to
my
get it
gosh.
hooked back together, middle of the night. Not to mention a couple of $40 follow-up visits.
Wow.
So by the time it was all over with, we've spent pushing $600 on this cat that lived under the couch, and all she did was meow at food time.
So did you keep it?
Oh, yeah.
You better. It's an investment at that point.
Did you acquire the pet as a kitten or as an adult cat?
Oh, they're both adults when we got them. They were young, but they were full-grown adult-wise.
Wow.
Many times when a cat hides under a couch, it's been mistreated. It's
that's the whole idea. I really don't think she was treated very well at all.
Yeah.
But now she lives anywhere she wants to
I
in the
bet.
house.
For that kind of money, sure.
Yeah.
Thanks for sharing that, Kevin. Judy's up next on WHO. Hi, Judy.
Good
Hi, Judy.
afternoon, guys.
What's your story?
Well, I actually Usually they go back to back with one another. We have had several animals. I was born and raised on a farm in Waterloo, Iowa, but moved to the city, and the first cat that I got him out at Pet Ranch, and he was a baby. He was the run of the bunch. Mind you now, but now he weighs 23 pounds.
Mm-hmm.
He's a long-haired yellow tabby. But when he was 4.5 months old, he got extremely sick. I mean, real sick. He wouldn't eat, wouldn't drink, couldn't go to the bathroom, and I went bananas. Took him over to the ER, and they told me that he had urethra infection.
Mm-hmm.
He was overdeveloped, too. So he wasn't even 6 months old. We spent a little over $600
Wow.
for his infection. And then Oreo Cookie, who is his sister or companion, we sprayed him with Walmart flea and tick spray, and they were both young. She has short hair, but they like to groom one another. She got real sick and almost died on it.
Boy, Judy, you just had lots of problems there. And Dr. Porter, I'd ask you, as far as the cat not going to the bathroom, that's an obvious sign that there's some major problems there,
Right,
right?
yes. You usually have a urethral block on that. Of course, they can't urinate. And then if they get a complete blockage, and usually uremia will develop, and that backs up and destroys the kidney and into the liver, and you lose the cat.
Now, we've already heard we're hearing a couple of stories here, and money seems to be the big concern. Should pet owners expect to spend $500-600 on a one-time trip into the pet ER?
Well, the prices in Iowa are a lot less than California.
That would have cost more out there.
Yes, it would cost more out here. I guess the economy's a little different. But the thing is that a lot of people don't realize that the education of a veterinarian probably exceeds the professional education of a doctor, because we have to study more animals. And,
but I think it's more
that way. I think that maybe that puts it in a little different light. I've had a lot of people tell me that they're only going to raise 2 children. The families are smaller this day and age. They're only going to raise 2 children, but they're going to have their pets, and they're going to treat them like one member of the family.
Right.
And I guess with that in mind, and I've even had some people say, well, we don't have to educate the cat, so we'll spend whatever money we have to do on it, or the dog, or whatever it is. It's the mindset is different. I think it was when animals were on the farm.
Yeah, well, there are people who do treat the pet as a family member, and they would have no problem spending that kind of money.
We've had some surgeries at the emergency clinic here that gastric torsion and that by the time you have anesthetic surgery and maybe 3 hours of surgery with 2 people, that you got a couple $1,000s wrapped up in it.
Let's try Ellen. Real quickly, Ellen, can you give us a quick story about your pet?
I was just wondering if you or the vet have ever heard of turkey disease in a dog. We had a schnauzer, and he had turkey disease. One morning I got up, and he had thrown up by the back door. And I knew my husband could not possibly clean that up, so I cleaned it up, put it in a sack, thinking it was worms. And I got my husband out of bed, and I said, you get this to the vet right away. I want to know what we have to do. I don't want to have to clean sheets every day for a week or 2 weeks and take medicine for the kids, and went on and on. I was just irate with him because I'm not one to have a pet in the house, but the kids and my husband would rather have the pet than their mother. So anyway, he takes the dog to the vet. He doesn't even look in the package, because anything like that would make him sick at his stomach. So he comes to work where I'm at, and he says, the dog has turkey disease. We have to take pills for a whole week. You have to change the beds every day for a whole week. And I'm, of course, going through my mind as he's got worms. Well, come to find out, the dog had gotten into the garbage, and it got into the netting of the turkey wrap that goes around the turkey.
Oh.
And it eaten it, and it thrown it up. And it looked like worms when I looked at it.
Have you heard that one before, Dr. Porter?
Well, I've heard of them throwing up a lot of skin and wrappers and things like that, but I've never heard it called turkey disease before.
Yeah.
That's a first. Thanks for sharing
that.
That's
what my husband told me it was called.
Okay, Diana, you get the last story here on Winsenberg on the Weekend.
Well, actually, I have a question if this is normal or not.
Go ahead.
We used to have a cat by the name of Evashevsky, and I took it to the vet for a normal check, and he was just checking her over and everything, and he says, well, we need to get a temperature on her. And so he did a rectal temperature on her, and as he did so, Evashevsky started purring. So I'm looking at the cat. I look at the vet, and my face turns red. Is this normal behavior for a cat?
No, usually they don't. They object to it as much as the person, but I think. But every cat has its own personality. I think he probably was happy to be in the environment that you were in rather than what was being done to him.
Okay.
Yeah. Well, it's something. Thanks, Diana. Dr. Porter, you got to tell us real quickly, the monkey with hives. How come you treated a monkey?
Well, it wasn't my intention to treat the monkey. The answering service called me one night and said, we have a lady on the phone that has a question about her monkey. And I said, well, I just don't treat primates. And she said, well, it's just a question. Can you help me out on that? So I said, okay, connect me. So the lady said, well, my monkey has hives, and it needs an injection of antihistamine. And I said, well, I don't treat primates. She said, listen, doctor, you're a veterinarian. You ought to be able to treat a monkey. And so they kind of got under my skin a little bit and said, okay, I'll see the monkey. So we met at the hospital, and she brought it in and put it in the exam room, and took the monkey out of the cage and was holding the monkey, and it did have hives. She was perfectly right on her diagnosis. And I picked up a syringe and then put a little antihistamine in the syringe and then daubed a little alcohol in the cotton. And just the instant I touched the back leg of the monkey with the cotton and alcohol, it bit the owner and got loose in the exam room.
It started jumping all around?
Well, it jumped from the exam table over to the counter, and then we have a lot of glass bottles in the counter that have cotton and swabs and different things like that, and started throwing all these at me.
Oh, it did. Just like in the movie, it started throwing the glass on the floor.
It had glass all over the place. And so then the monkey jumps up on top of the little countertop refrigerator we had that holds vaccines and backed itself into a corner and rolled up his lip and snarled at me. And the owner said, doctor, will you step out of the room? We'll never get the monkey down as long as you're in here. So I stepped out of the room, and I thought, well, I'll just go I made a cup of coffee and walked up and down the hall a little bit. Finally, she opened the door and said, will you hand me a broom and a dustpan? And I could hear her sweeping up and cleaning up the room. And finally she said, you can come back in now. And she had the monkey under control, and I proceeded to give the antihistamine to it, and everything was
Well,
okay.
that is one thing I learned from your book, is that you pretty much have to have the owners in the room to help you with your procedures.
Right, because they're the only person I have. I have no professional help to help me in there or lay help or anything.
Well, folks are just going to have to get the book if they want to hear about the cat that was in the dryer, because that's one of the funniest stories, and it's incredible. People should think twice before they shut that door if they have a cat, because that dryer can be a dangerous place. But Dr. Porter, thanks so much for sharing your stories with us today.
It was a pleasure.